I'm Julie Guinn. I'm an experienced designer in the Jefferson Health System in Philadelphia. I came to the IDSA conference with a colleague of mine. We're both in the Center for Innovation at Jefferson, and we're giving a talk here today about how doctors and designers can collaborate. I would say the intersection of design and healthcare is really a growing area right now. I think with all the changes happening with the Affordable Care Act, a lot of health systems are starting to realize the impact that design can have on health and healthcare experiences, and they're starting to look at new ways to bring design kind of into those experiences, either by forming in-house design teams, starting to partner more with consulting firms and with their vendors to make sure that everything from the space to the equipment to the flow of patients is a positive experience and provides great care. I'm giving a talk with my colleague about doctors and designers collaborating. Since bringing designers onto the front lines of healthcare is pretty new, and because doctors and designers come from really different cultures, when we start to collaborate together, you can run into some barriers in communication and understanding. And so we're giving a talk from our own experience of kind of strategies we've used to make it work. I guess my hope for what people would come away with is first of all, an optimism that we can have a positive impact in healthcare, things are going to get better, an excitement that the healthcare industry is really starting to embrace design. There's a lot of new roles and opportunities, and just some new ideas in people's heads when they leave, new things to think about, new things to be aware of. I think because healthcare is so complex, I think a big opportunity for design in healthcare is just the approach that designers take, our ability to see a systems view of a problem, to break it down into its components and start to approach them in a structured way, and to evaluate a lot of potential solutions. I think that's a huge value that designers bring that's not currently present in healthcare, which tends to try to narrow down. You know, you're looking for a diagnosis, you're looking for the single best treatment. So I think designers bring that broader approach. Something I'd like to leave the viewers with is that IDSA itself, I think, kind of reflects what's going on in design and healthcare right now. There's this interesting intersection between a lot of different fields. So design is really broad. There's industrial design, experience design, service design, graphic design, and wayfinding. And this is a conference that can bring all of us together because healthcare encompasses all those things.